What about just like personal, when like talking to patients, like them disposing their own like?
Okay, so sometimes there are scenes like, where it's unfeasible for patients to actually go to a place, where they can return the medications. So there's like a list of medications. So in general, the drugs are not safe to be disposed of, like not common ways, like, just flushing down
Yeah.
the drain or the toilets. There are list of drugs that are safe to dispose of in a way that are unsuitable for human consumption, like we need to first check what drugs are those. So maybe if it's hard for patient to get off, they can kind of crush it and then mix it with either cat litter or coffee grounds, and then they can either put it in a garbage bag, seal it, and just let it go with the regular trash, or then either they can flush it down. But that's very basic thing, we usually don't recommend. But first, even if we do, we have to see what drugs are those, because flushing down the drain, it's affecting, like the water for people usage and everything. So there are some drugs that are safe to just flush down the drains. So we first need to see, like what drugs are that with the patients, and then we can, but that's the most common method, like like mixing it either with the cat litter, coffee grounds, and then disposing of. Basically the goal is that that drug should not be reused or used by kids or any other people. That's a little bit harmful for them. That's how we recommend.
All right. And then have any of the patients like asked you about just on the environment, like if there's any impacts? Have they asked you?
So basically, not really, they don't really ask what's the impact, but like when they ask us, like if they can destroy drugs on their end, it's our like responsibility to explain them it's not safe. It's both environment and other people, because there are a lot of drugs that are habit forming. So if they're destroyed in a way that's easily accessible to other people, they can consume it, and there's like chances of overdose and a lot of other things. And in terms of environment, it's mainly like down the water line, like exactly, and then the sea life it's affecting. So basically that's what it is. But we don't get that many patients who are really asking questions on that. But if they ask us to destroy it in a way that's gonna impact the atmosphere, then it's our duty to tell them not to do so.
Yeah.